is discussing strategies for driving economic growth and creating jobs opportunities in Africa. Okay, so our discussion is around the strategies for driving economic growth and creating jobs in Africa. We will look at your various fields of business and see how you've made it possible to impact growth and creating job opportunities in your field. So let's start with Dr. B. You're all the way down there. Please, she is our beautiful esthetician, Dr. Beatrice, with her practice in Ikoyi. Please, what strategies do you think can be put in place to create economic growth and creating jobs in Africa?
Known as Dr. B. Within the healthcare sector, first to push forth economic growth, first of all, we need more education. And I have to put it forth for the healthcare sector in Nigeria, it's deteriorating faster. We can look at the mortality rates going on now. Within simple maternal mortality rate has increased 14% in the last 2 years in Nigeria alone.
So it went from about 927 to 100,000 live births to now it's about 1,047 to 100,000 live births in Nigeria. So we need more education for the healthcare sector. It is being abandoned, and therefore there'll be no jobs creation in the healthcare sector because there's no further improvement within the educational sector around there. A lot of the doctors, they're relocating to countries that are appreciating the doctors. Two, we need for the doctors or the healthcare sectors, doctors, nurses, pharmacies, everyone within the healthcare sector, we need improvement of their salaries. It's very important that these people are paid. Two people that are important in your lives, apart from your family members, is your doctor and your lawyer. And if the doctors are not being paid well, or people in the healthcare sectors are not being paid well, how can we foster economic growth when the healthcare sector continues to deteriorate? I mean, this is really, really bad, and it's something that needs to be looked into. Also, we need better infrastructure. I mean, I just read a case today, and I was so heartbroken about a woman who got her child swapped in Bagada General Hospital. And the maltreatment of the patients, the lack of infrastructure, it was so bad that, in fact, the baby died, and they gave her someone else's baby and told her the baby died. I mean, poor infrastructure, poor system going on within the healthcare sector. What is going on in Nigeria has infiltrated into our health. And if we cannot trust people within the healthcare sector to help us, then what are we doing? You see those people within the healthcare sector, they're also leaving Nigeria because they know that they cannot give Nigerians what they were trained to do. Now they're chasing after wealth or income rather than chasing to save people within the healthcare sector. It's very important. I mean, I don't know how we can compare it, but I really feel that for us to foster economic growth here in Nigeria, and I like to say Nigeria because when people say Africa or any other, we don't want to include all those other countries. We want to include ourselves. Let's the change start within us. Please, we need better infrastructure, salaries, and education for our healthcare system. Thank you very much.
Oh, thank you. Thank you very much.